Details have been disclosed about the initial guidelines to our path out of the pandemic. And for more on these efforts to transition into a new normal, I have Professor Chung Gi-seok from Hallym University. It's a pleasure to see you again, Professor Chung.
Good afternoon, Sunny.
I also have Dr. Kim Seung-taek from Institute Pasteur Korea. It's good to see you again, Dr. Kim.
Good afternoon.
Professor Chung, we'll start with you then. Korea has fully inoculated 70% of its population. That milestone was reached this past weekend, and it came after 8 months. What is your assessment of our inoculation drive?
Well, finally we achieved 70% of our people get vaccinated fully. And there are many countries behind us, like United States, UK, French, Germany, even Japan. That's all because of, first of all, government has done a lot, but mainly because of our people's compliance with vaccine. Because vaccination rate, for instance, for influenza is #1 in Asian Pacific region. The Koreans are very eager to get vaccinated, maybe top 10 globally. So that's the main reason why we have achieved one. But we have to remember that 70% means does not necessarily have all 70% people have immunity, because theoretically we should multiply by 80%. So 70% by 80% means 56%. That means 1 out of 2 has immunity to COVID-19. That's good. But we have people who are waning their immunity after getting vaccination too early in this year. So I suppose maybe less than 50% of our people will have immunity. So please be very cautious when you are all fully vaccinated or not.
Right. And Dr. Kim, despite the advances on the inoculation front, there are more than 1 million people in their 60s and above who have yet to register for their vaccines. Now, having said that, what can be done to encourage these individuals to seek vaccination?
Well, we all know very well about the some vulnerability of the people in this age group to the COVID-19. But what we always also at the same time we also just talking about just the risk and the benefit. And in this specific age group, the benefit is just much more outweighs the risks. And then also in terms of the adverse effects, the people in this age group is experience less likely, less adverse effects by the vaccination. So there are many just good effects by the vaccination in the case. So the effort we have to actually just emphasize is that to deliver this very just positive effect of vaccination to this group of just people. And then probably also some incentive for vaccination just might work in the end. And also I always try to ask this question just to everyone. Just eventually within this depending on how we actually just cope with the COVID-19, within like several years or like several years, somehow just people will just get exposed and somehow will just acquire just immunity to this the COVID-19, the SARS-CoV-2. But then there are only 2 ways, whether we get the immunity after actual infection or just by vaccination. And I think just the answer is very clear, to get vaccinated.
Right. So the question is, do you want to get the immunity through being infected with the virus or through inoculation?
Exactly.
Right. Professor Chung, earlier on Monday, as we mentioned earlier on the program, authorities made public their preliminary exit plan. How do you respond to this plan?
Well, generally speaking, it has the right direction. But what I am concerning is the speed. If you speed up the easing of all restrictions, then we'll meet another big wave, because this is a winter time and we are heading for a very cold season. First of all, the first step is easing restrictions in essential facilities like cafe, restaurants, and theaters, and etc. And the next step will be planned in 6 weeks' time, and we'll be allowing mass gathering over 500 people. And the last step will be doing, hopefully, in 12 weeks' time, then there's no restriction at all. Even the private gathering will be allowed as many as possible. But we have to consider some hurdles on that, because government are hurrying up at-home treatment. But as we have seen before, already there are some accidents in treating at home. And actually, this is not treatment at home. It's a standby at home until the spontaneous recovery of COVID-19, because we don't have any antiviral specific agent at hand. And the other one is emergency transfer system is not well established, because 228 local government is in charge of handling of treatment and isolation. They are not doing the same quality administration. That's the main factor in going to easing restrictions.
Professor Chung, do you suppose that our efforts to ease restrictions in the country should be focused a bit more, based a bit more on our level of inoculation? Perhaps should we be looking at a higher level of inoculation rather than 70% of the population, maybe 90%?
Well, higher the better, because you have a higher inoculation rate, you have a higher percentage of people who have immunity. But it doesn't, it should not be a strict indicator, because even though you have 90% of, let's say 84%, like in Singapore, you have increased surge of people and increased death rate in that country. So the more important factor is transition to a severe and very severe cases. Currently in Korea, the rate is a bit decreased from 2.2 or 1.5. It's September statistics. But case fatality has increased. It's increased from 0.35 to a 0.78. That's why we are seeing more dead people these days than that. For last week, we have more than 10 people that die of COVID-19 daily. So we need to consider not the percentage of completed vaccination, but case fatality and transition to severe and very severe cases. That's the main reason we should pursue, that the main parameter we should pursue. And because if we have more than, let's say, 1,000 ICU patients suffering from COVID-19, then the hospitals cannot endure that kind of situation, because we have only 8,000 adult ICU beds all over the country. If more than 10% is occupied with COVID-19, how can you treat other people suffering from cancer, neurology disease, heart disease, and etc.? Because almost all big hospitals are always occupied by severe patients in ICU. So there is no way to treat not only the COVID-19 ICU patients, but also all the other caused ICU patients. So
Right.
you must be very cautious.
Right. And speaking about being cautious, Dr. Kim, starting next month, then a total of 10 people can gather socially, regardless of their vaccination status, and most restrictions on operating hours at most businesses like gyms, cafes, as Professor Chung has mentioned, have been lifted, with the exception of nightlife entertainment facilities. What are your thoughts on this ease in restrictions?
Well, I think most of the experts somehow just agree on that the case numbers will just increase. But the point is that whether we can actually just control the number of just, well, not just the simple case, but the number of just severe just COVID-19 under the level that we can just manage in our just some severe patients in the, for example, like a number of just ICU beds and the number of just the healthcare workers. So that's the key point. But somehow this was kind of just now just delayed. Now it's more than 1.5 years of social restriction. Somehow just the government should just think about some sacrifices, mostly some sacrifices from the small business owners. So this kind of some compromise in between just a vaccination rate and also just easing the some social economic just burden right now.
Right. Then Professor Chung, as Dr. Kim has mentioned, the expectation is that there will be a resurgence once restrictions are eased. Having said that, what can be done perhaps to prevent an alarming resurgence in the days ahead?
Well, everybody should be very cautious. It's kind of a festival. People are very excited about easing the COVID-19 restrictions. One day we'll get there, but if we haste the process, then we'll meet another big wave. I had a word with an old friend of mine living in Singapore who is a pulmonologist, and he told me, actually advised me, that the main factor that the Singapore failed after 84% of vaccination, they had a surge of many patients and mortality rate increased temporarily. He said to me that the Singapore eased restriction by the time 70% was completed. And they think that it was too early. This is the time we are having 70% right now. So that's another lesson. The other lesson is they have started injection too early, very early, not too early, January and February. And there are many people who have not enough antibodies by this time. So that's why they are having another resurge of COVID-19 infection. So if you look at Israel, they are very eager to do a booster injection, and they are controlling their situation, not bad. And when you look at the UK, they eased all the things by July. Even they didn't get the 70%, and they don't even wear masks, and they get together very freely, and they are suffering from lots of patients, 50,000 patients every day, even though the mortality is a bit low. The Denmark, one Danish told in the broadcast that they are doing very well. But he said, vaccination is the best policy. There is no other magic bullet. So all the information get together. All we have to do is very cautious and wearing masks and get booster shots as many as possible and as widely as possible. That's the lesson we should learn from the other countries.
Right. And going back to our efforts to ease restrictions as we move into a new normal, Dr. Kim, some establishments, including nightlife establishments and singing rooms, require proof of vaccination for their customers. This is bound to cause a bit of conflict, some observers say. What are your thoughts?
Somehow, but I think at the same time, we are somehow also just now get used to the such kind of just system. For example, like in some cafes and restaurant, you are now get used to some just the pushing the some QR code for just register or just presence in that specific place. So there might be some a little bit just some conflict, but not just some tension. But I think it would be just resolved at the end. And I think this decision is a kind of a legitimate just compromise between the vaccinated people and the unvaccinated people. And then in one side, we actually have to just respect the choices of unvaccinated people. But at the same time, we also have to protect some other people, including themselves, and also just business owners. So I think this is kind of just a legitimate compromise in between those choices.
Right. And also, Dr. Kim, starting next month, those who are asymptomatic or have mild symptoms will now be required to be treated at home. Having said that, what support framework do you propose to ensure their well-being?
Well, Normality is actually just considering some such kind of just a response to such kind of the system. But I think one of the things is some very rapid and instant just the communication, the system almost like a 24/7, and also some implementing some very fast transportation systems to the some nearby just local hospitals to just cope with such situations.
Right. And Professor Zhang, come Friday, authorities will share their final blueprint, exit blueprint that is. And having said that, what are some revisions that you would like to suggest to the current framework that was shared on Monday? Do we need to make any revisions?
Yeah, I actually advised to officers in government for some points yesterday. And among them, I like to emphasize the home treatment system to be more supported and to be well equipped, because government is going to allow almost all people less than aged 70, either whether they have underlying disease or not, they can stay at home. But that is not a good choice, because if you are older than 65, it's technically elderly people, and you can have underlying disease even though you cannot aware of that. So that's the case. We had a 6 to 8 year old who are known to have no underlying disease, but he died all of a sudden before getting to the hospital. So I recommend the age group less than 65 or 60. And if he or she had the underlying disease quite seriously, then he or she should not stay at home. And as Dr. Kim mentioned, the emergency transportation system should be well equipped, because if you don't have that kind of system, there is no way to keep those vulnerable patients at home. It's just observation. It's not a kind of treatment. And so, and the other one is they have more than 50 pages of propaganda in their announcement. In that, they are going to narrow the epidemiology investigation service, because they narrowed the duration and then they narrowed the population. So in that case, I'm worrying about the silent spreading of infection, because now still we don't have more than 30% of people who don't have any infection source. But in that case, maybe more hidden patients will be spreading their infection while we were enjoying easing of restrictions. So I like to recommend to strengthen the EIS service from now on, even though they keep easing the restrictions. So again, I like to mention about ICU care readiness, because if you have more than say 1,000 or 1,500 ICU patients, then the medical support can be threatening. So I like to mention those some points in preventing disaster.
Right. And the same question to you, Dr. Kim. What are your recommendations for possible revisions to the current plan?
This is not just a new recommendation, but this already just discussed in the meeting, the discussion meeting. And then I think it's a good idea that we can just come up with some sort of just a circuit breaker, the measure, or like in the stock market. So when some percentage of the ICU bed is just occupied, like 60% or 80%, then we can just impose such kind of some warning system or alarming system, like 60%. Then not just automatically just transition to the after 6 weeks and then after 6, but then we just monitor mostly some severe cases. So if there's some, and then also considering the number of just beds available in the hospital, so then we can just implementing some kind of circuit, the breaker in our transitioning into just a normal life.
And when should this circuit breaker be imposed, in your opinion?
I don't know about just the experts are thinking about some 60% or just 80% of just occupancy of just hospital beds, especially just severe COVID-19.
I see. Hopefully that will not be the case when we ease our restrictions.
Of course not.
All right, Dr. Kim, as always, thank you very much for your thoughts. And Professor Chung, thank you for being with us today.
Thank you.